Good day. I am Princess Diana Jane Tapotabo from BSN 12 and I am going to perform the Leopold maneuver. So the Leopold maneuver is a systematic and palpation of the abdomen and the position of the baby, and also we can also locate and hear the heartbeat of the baby inside the womb. And also the purpose of the Leopold maneuver is to determine the number of fetuses. So, but before that, um, we need to learn about the four parts of the Leopold's maneuver. So we have our first Leopold's is known as um, the have these are includes umbilical, pelvic, the also the fundal, and also the umbilical. So what is the person that it is the purpose is to see the presentation or the location of the baby inside the womb. So that's it. And before that, we need to introduce to our patient, but introduce ourselves to patient to cooperate, to ensure the cooperation of the patient and also the comfort to make comfortable while doing the procedures. So since I have no patient for today and I only have this temporary patient, for like you need to imagine it, even you need to have imagination while doing on this. So the patient is um her name is Queen. So her birthday is October 29, 2003. So first step is we need to introduce. So hi, I am Princess. Hi ma'am, Queen, I am Princess. I will be student nurse for today and I am going to perform or demonstrate the Leopold's maneuver. Is it okay to you, ma'am? Okay, because I because there later on what I am going to do is I want to I want to palpate your abdomen here and also put a little pressure on it to identify, to locate the position of the baby. And also we need to ask the patient um her birth date, her name. Also we have to get get a wristband on our patient for um for safety processes, and also easily to find the patient because there is a name on her hand here. So next is we need to um, we need to we need to educate our patient what we're going to do so that the patient will cooperate while doing this task. So next we need to perform the lupus maneuver. The lupus maneuver, it has a four part. Okay, it has a four part which includes the umbilical, the fundal, the pelvic, and pelvic rather. So that is important to look. That is very important. The four the four Leopold maneuver to determine the position of the baby inside. So third, but before that, we need to prepare our equipment. So but while doing before doing a lupus maneuver, make sure you use your warm hands for provide the comfort to our patient while doing the assessment. And also we need you to use the palm, not the fingertips. Okay, for next is um, we need to um, prepare the materials. So we have our materials which includes the stethoscope for assessing or auscultate or for hearing um, the fetal heart rate of the baby, the fetal heart pulse rate of our baby. So which part of the stethoscope that we need to use? of course, this bell, so you can easily hear inside the 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 tummy of the mother. So next is we need a pillow. We need a pillow for, and put it on in the under, put it under the the under the head of the patient. Okay, next is the bath towels. Make sure you use that towels to tell the uterus in a super vena cava to prevent the what we call the syndrome in hypotensive syndrome, for the supine hypotensive syndrome. So that's it. So next is af- after that after that we need to urinate. You need to urinate first the patient to to and a to what we call it, this with this is enable to provide comfort, and also the patient won't discomfort throughout the procedure. Okay, so next, after we urinate the patient, is we need to make sure the patient will provide the privacy. Okay, privacy is to ensure the patient's comfort. And also, after that we urinate the patient, we need to allow the patient in a supine position, so that the patient so supine position, and also the pillow under her head slightly flex the knees, to to the allow the allow the muscular in the inside of the preparing on this. So the what we call the muscular muscles inside, um so it it makes relax while doing this. So next, if you are right-handed, stand at right and facing the patient to ensure the accurate findings. So next, we need to so let's begin to our first maneuvers. First maneuver, while facing the patient facing the client's feet. I rather we while facing the patient, you need to palpate the uterine fundus to determine what part of the what part of the fetus. The fetus lies in the upper part of the uterus, upper part of the uterus of the mother. It may be cephalic cephalic presentation, in which the head comes first, or breech breech presentation, in which maybe the buttocks or the feet comes first. And also, we, what is the and also the fetal head. So what is fetal head, and also the fetal head and the breech presentation of the baby. So what is fetal so what is fetal head, what is feels like. So the fetal head feels like a hard and round. Okay, and next is the breech. So next is a breech presentation. So what is a breech presentation? It is a smooth, and it is soft and nodular. So they are movable and ballotable. So next, we need to here. So this is the first maneuver. We need to. So here is the part of the abdomen in the upper, and we have our pubis anterior here, fundus in the head. Here is the and this side is located the head of the baby. So say if this is, we need to palpate on it. make sure you need to feel or to press, need a pressure to determine the location of baby. Okay, for the cases of this is, here is the breast representation of the baby. Here is the foot and also the head here, the baby, which is starting with the fundus. Yes, starting fundus and up to here in the pubic area. So next, let's proceed with our second maneuver. So second maneuver, palpate the um, downward direction. So palpate the downward direction, um, palpate the downward direction um, on the under the un, under the abdomen. So over the abdomen, we need to palpate in it and palpate using deep but slightly gently pressure, so that so that we can determine the uh, the fetal back and the extremities. So here, put pressure in it and the pressure slowly, so we can say, so we can locate or we can palpate the baby inside of the womb, the okay, the head and the back. So what is fetal back? So the fetal back is is a long continuous structure that feels, while the extremities, it is a nodular feels, reflecting the extremities, extremities like the extremities here, nodular. So okay, next, for the third maneuver, we need to start, place one hand under the over the symphysis pubis, um, grasp here like this, this this is the 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 head of the baby. So here, so put one hand over the syphilis pubis and grasp the lower uterine segment by using our hands and thumbs, our thumbs and fingers rather, to um to feel the presentation part. So next is like this. Okay, so next is the fourth, lastly the fourth maneuver. So fourth maneuver, I will be face my be face the feet of the patient, and also confirm, and you what um, don't forget to confirm the findings of the third maneuver, okay, to determine the flexion of the vertex. So we have here, this is shown. So we have our, here is the, like the head of the baby is flexed, and also the same as the back is um um extended. So here in the permanent cephalic permanent of the vertex, like this. And then after we after we after we locate um, the baby inside, we need to use our stethoscope to auscultate the heartbeats of the baby. So the normal auscultate is 110 over 120. Okay? Okay? So I have here the bell of the stethoscope so that I can, okay, so we could allocate the back of the baby. So here, okay? So I have here. So um we need to use our wristwatch and in a full minute, in a 1 full minute. Okay, that's it. And the heartbeat of the baby is 110 over 160. So the normal heartbeat. So we can also note the the location of uh, the quadrants of the baby. Where is the left quadrant or right quadrant of the pulse rate of the baby. So next is we need to document in it. And also we need to share information of what we're going to do after this. We need to share it to our patient for documentation. So okay. So okay na, thank you for your cooperation, and the the result of our findings that we already observed is definitely normal. So make sure you need to um, need to have an exercise and eat healthy foods. And after that, you need to disinfect all the equipments. And also, that's all. Thank you.